Wednesday afternoon. So as I think everybody understands, there's been significant changes in the Missouri vaccine rollout plan that we detailed on Monday, as well as giving at least an initial broad sort of overview on how vaccine is going to be distributed within the St. Louis region. So just to reiterate, as a reminder, the COVID-19 vaccines, the goal is to get these out as quickly and as efficiently as possible, all while trying to ensure that we're meeting those high-risk groups or those groups that need to get vaccine. But the shared goal is to vaccinate as many people as we possibly can, as quickly as we can. So just to, again, go over those eligible populations. So the 1A population that I think everybody mostly understands, that's the patient-facing healthcare workers. And we're continuing to get through those groups. And so most of the healthcare systems, so hospitals, places like that, have pretty much finished vaccinating all of those workers. So now it is getting those healthcare workers out in the community that are not affiliated with the healthcare system, as well as emergency medical services and school nurses, getting them vaccinated as well. And we're starting to get a better understanding of who all that population is and getting them in to be vaccinated. But we're still working through that population. Now, the other two that the state has said were now eligible as well for vaccine are that Group 1B Tier 1, which is mostly the first responder groups and some other public service sector groups, and as well as sort of those non-patient facing healthcare workers and public health workers. So again, the healthcare systems will take care of those non-patient facing healthcare workers, but public health will be organizing those other groups such as first responders, law enforcement, other civil servants to get them in the queue to be vaccinated. And then that third group is that 1B Tier 2 group, which, as we detailed before, is rather large. So that is persons over the age of 65, and then persons that are between 18 and 64 with a chronic medical condition that are listed on that state website. And that is a large percentage of the population, anywhere from around 35 to 40% of the population. Now, the way that work is, again, going to be divided up. The healthcare systems understand who their populations are that fit that criteria. And it's dependent upon each healthcare system how they're going to organize that patient population. So, for instance, within SSM, there will be invitations sent out to groups of people that you are eligible to receive vaccine, and then go through a process to get it scheduled through our internal system. And BJC, Mercy, St. Luke's have some sort of same system like that, but also some open scheduling is out there as well. So it really just depends on which system you're talking about and which tier you fall into on where you can go to get registered so that you can get scheduled to get vaccinated. The second point to bring up with all of this is that it's entirely dependent upon vaccine amount. And so if we have consistent supply of vaccine where we understand how many sites can we open up on any given day and get people scheduled, then we can move much more efficiently. If our supply is sporadic or we don't get consistent delivery, then it makes it harder to schedule, and so then that creates a little bit of a time delay. We're working on these issues with the state. I know that the state is also dependent upon what they get from the federal government. So there's many sort of cogs in this whole machinery that have to all turn at the same time in order to make it the most efficient process possible. So we're a little bit less than a week into this process. There's going to be further refinement to this, but again, the whole goal across the region, healthcare systems, public health, with everybody, is to get as much vaccine out into the community as we possibly can. Everybody is committed to that, and we appreciate everybody's patience in helping us to develop a system for efficient delivery. So we're going to go ahead and move on now to our hospital admissions data now and go through the regular part of our presentation. So we did see that, slight decline in cases yesterday that were reported yesterday. Remember, they're lagged by 2 days. The number came back up, unfortunately, again today. So we are sitting at 92 admissions from 48 hours prior. So again, we're still seeing a large amount of admissions that are occurring on any given day. Our 7-day moving average is at 96, below 100, but still very high. So we still have to remain vigilant doing all of those things in order to prevent spread, because we're still seeing a high number of patients. And remember, there's those different variants that are still sitting out there somewhere, that the UK variant that everybody's heard of, which could potentially create more cases, create more hospitalizations. So even though we have come down from our highs, it's still just as important to maintain all of those different strategies that we've been talking about. Now let's move on to our hospital census data. Ticked up a little bit from Monday, so 673 today compared to 670 on Monday, so we're hovering around that 670 mark. Our moving average is a little bit below 700. So still, again, high number of COVID patients in our hospitals, not as much as at our peak, which is good, but still a significant amount. The other piece to that is what we have found is, even though we have a less contribution to our patient census from COVID, we're still maintaining our census from all of our other non-COVID patients. So for instance, yesterday when I was looking at our SSM data, even though our COVID patients have come down, our hospitals are full with non-COVID patients now. Our ICUs were above 90%. And I confirmed this with our other healthcare systems as well, and so everybody is seeing the same trends. As our COVID patient population comes down, those beds are getting filled up with other non-COVID sick patients. So it really hasn't taken the volume off of the hospitals. The stress is a little bit less because we don't have to worry about PPE and things like that. But the hospitals are still very full, and so it still is a very challenging environment for the healthcare systems. A little bit more detail about our numbers today. So as I mentioned, we have 673 patients hospitalized today with COVID. We have 126 COVID positive patients in our intensive care unit, which is down from 134 yesterday. And we have 89 confirmed COVID positive patients on ventilators today, which is a little bit up from 86 yesterday. Now looking at our suspected COVID patients, as you can see here, we're reporting 59 patients hospitalized today with suspected COVID, 18 suspected COVID patients in our intensive care units, and we have 7 suspected COVID patients on our ventilators. A little bit about discharges. So again, our good news slide, we did discharge 91 patients from our task force hospitals yesterday, which brings our cumulative total to 16,753 patients. And again, a big shout out to all of our healthcare teams and everybody that supports them getting these patients well enough to go home. Unfortunately, we're still seeing a significant number of deaths, certainly not our highest, but we were reporting 17 deaths yesterday, inpatient deaths from our task force hospitals. And that brings our 7-day moving average up to 14 deaths per day. And again, this slide, just to reiterate that this is all connected. If we want to get the number of deaths down, we have to bring our number of hospitalizations down. And that means we have to get our case numbers down out in the community. And that's dependent upon the community. That's not dependent upon healthcare. And so we appreciate everybody's ongoing efforts to prevent the spread of this deadly disease. It is Wednesday, and typically we go over our scorecard on Wednesday, and so we're just going to highlight a couple of things in our scorecard today. So a couple of things that I think are kind of exciting data to share. One is the contribution that COVID patients are contributing to our hospital census. And so I mentioned this earlier. So we are seeing that come down. And so we're a little bit under 15% for total bed capacity is occupied by COVID and PUIs, so patients under investigation. So that's good news. It's in that yellow area. And then we're sitting around 21% for our ICUs. And so again, our red line was at 20%, so we're sitting just above that. So it is continuing to come down. Hopefully that trend will continue as well. So that's good to see. We just need the trend to continue. I've already spoken about our new admissions, so I'm not going to spend any time on that data, still sitting at 96. The prevalence has come down as well, so it came down from that high point of around 11, so we're at around 7.6, and that continues to come down. And that number will continue to come down if the cases continue to come down. So it's a 14-day rolling sum. So as large numbers drop off on the back end and smaller numbers come in on the front end, that number will continue to come down. Our weekly change came down as well. So we're at a minus 11%, which is in our green area. And again, that's always contingent upon how many new cases we're seeing out in the community. So again, if we see lower case numbers, then that percent is going to come down as well. And so that's good news. And some of our low marks there that we've had in the past. And so we need to continue to do that. And if we can continue to keep this number low, then we'll decrease those number of cases, decrease hospitalizations, decrease deaths, and really help out the community. So that concludes our remarks today. And again, while we're distributing this vaccine that will eventually help all of us end this pandemic and return to normal, right now we still have a lot of virus out in the community. So still over 600 patients in the hospitals, still admitting close to 100 patients a day. So it's far too early to take the brakes off. So while we wait for that widespread immunization and herd immunity later on this year, we all need to continue to take those steps to prevent spread. That's the best that we can do. So staying at home, wearing a mask, not gathering in crowds, social distancing, all of those little things add up to help prevent spread in the community. So with that, I'll conclude my remarks and we'll take some questions from the media.
Does the task force have any concerns or questions about how vaccine is being distributed among healthcare systems throughout the state of Missouri?
So we don't get data on where vaccine goes within the state, or at least I have not seen it. And so the only thing that we know is how much do we get in the region. And I believe that the state has a process for how they allocate the vaccine. Part of it is how efficient are you in getting vaccine out the door, immunizing people. Part of it is a risk population. Part of it is how much of the population do you have in your jurisdiction. So there's a couple of different things that go into how it's allocated. The greater concern is the consistency of allocation rather than, are they allocating the right amount. And so that's I think the bigger challenge.
How far in advance do hospitals know the sizes of the vaccine shipments they will receive? Are they receiving regular amounts or is it more sporadic?
Yeah, that's a good question, and we're trying to wrap our arms around it. So typically we get notified around 24 to 48 hours before vaccine is shipped to us. And they come in a couple of different ways. So we receive two different shipments. So one is for what's called an initial dose vaccine sort of allotment. And then we get a second allotment for that second dose of the series. And so that's two emails that are separated, and it tells you which doses are which. So on any given week, we can expect 2 separate shipments and 2 separate emails around 24 to 48 hours spaced apart, which then makes it challenging when you're trying to develop your vaccination side if you don't know consistently how much vaccine is going to show up in any given week. So that's what makes it even more difficult to try and maximize your vaccination schedule.
Does the distribution schedule, for example, small amounts received at a time, make it more difficult to schedule and give out vaccinations?
Yeah, so as you can imagine, any time that you don't have consistency in delivery of any material, it makes it really hard to do operations on the back end. And so just sort of think of it very simplistically. If you were going to, build a bicycle in a bicycle factory, and you had, a bunch of bicycle frames, which we'll use as an analogy for the population, but you weren't sure how many tires you were going to get or how many wheels you were going to get to complete the bicycle, it makes it really hard to schedule your workforce and how your production line is set up and all of these different things in order to move most efficiently through the line. So not knowing ahead of time how much you're going to receive we do get a short amount of notice, but certainly we can't plan weeks out because we don't know weeks out how much vaccine we're going to get. And then having a large surplus of people that are eligible in a smaller amount and then unsure of that amount makes it even more difficult to schedule people to get vaccinated.
Do hospitals expect the distribution to become more reliable in the near future?
Well, we're hoping so. That depends upon a number of things. So it depends on manufacturing of vaccine. It depends on distribution of the vaccine. So, we have been told that vaccine production will increase. So when we first started discussing how much vaccine we were going to get, the comments or what we were led to believe is that after the initial doses came out, that manufacturing capacity would pick up, and that after a couple of months, we would have a large amount of vaccine. However, more recent discussions have led us to believe that we aren't going to be seeing that significant uptick in vaccine, and we may be dealing with the amount that we're seeing right now, which again makes it very difficult to immunize significant percentages of the population in a very timely manner. So how we're going to get vaccine into the future, I think, is still a bit of an unknown. We do believe that manufacturing capacity will increase, which means more vaccine will become available and will be coming towards the states and then towards the locals as well. There will be different vaccines that they'll file paperwork for an emergency use authorization, specifically the Johnson & Johnson vaccine and the AstraZeneca. At least the Johnson & Johnson is a one-shot vaccine, and so that could potentially change the way that we are allocating and delivering vaccine as well. So there's a lot of moving pieces in all of this, and we still have to see what the Biden administration is going to do, whether they implement the Defense Production Act to help with production. That could be something that changes the volume. So there's just a lot of unknowns out there. But for right now, at least for the near future, we're not planning on seeing a significant increase in the amount of vaccine.
That concludes the list of questions received from members of the media prior to today's briefing. Thanks for watching.